This presentation is about lifespan considerations, health and safety risks for health assessment and promotion. First group that we're going to talk about are young adults. And young adults are late teens to early 30s. It's about 1/3 of our population. And our health and safety risks here are family history. You want to assess for family history of cardiovascular disease and diabetes, personal hygiene habits, contagious disease issues, issues with hand washing. This can also be dental hygiene, which can lead to gum disease and loss of death or periodontal disease. Violent death or injury examples which can lead to this situation are poverty, family breakdown, child abuse and neglect, involvement with drugs, both dealing and taking drugs. Death from injury can also come from physical assaults, encountering others with anger management issues, vehicular accidents, motor vehicle accidents due to distracted driving, and other accidents, and suicide. Intimate partner violence affects about 4.8 million women. Of the 4.8 million, 2.9 million of these cases are linked to smoking, alcohol, drug abuse, risky sexual behavior. Risk factors to be the abuser include drugs and alcohol, unemployment, low self-esteem, mental health issues such as antisocial and borderline personality disorders, the desire to power, and being a victim of abuse themselves in the past. Women who are pregnant and also during childbearing years are at a higher risk. Substance abuse. Intoxication can lead to safety risks such as motor vehicle accidents, accidents from during periods of intoxication can also cause disability. Alcohol and drugs can lead to chronic health risks such as liver disease and lung diseases. Dependence on stimulants or depressants can result, death can result from different reasons from stimulants and depressants. Stimulants or uppers can cause cardiac problems and nervous system disorders. And depressants or downers can cause accidental overdoses. One thing that's more common that we don't think about very often is caffeine. It actually stimulates the nervous system and increases gastric secretions, increases heart rate, increases metabolic rate, can cause an increase in blood pressure, diuresis and relaxation of the smooth muscle. Large amounts can cause restlessness, anxiety, irritability, agitation, sensory disturbances, heart palpitations, nausea and vomiting, diarrhea. Anytime you're assessing if a patient has a substance abuse problem or is at risk for substance abuse problems, we should be mindful to use non-judgmental questions during our assessment. Sexually transmitted infections can have immediate physical effects such as genital discharge, discomfort, or infection, but can also lead to chronic problems including infertility and even death. Half of all new cases of sexually transmitted infections are under the age of 24, patients under the age of 24, and chlamydia has the highest rate of infection. Then we also have environmental and occupational factors. This would include work-related hazards and agents that causes disease and cancer. Inhalation of talcum and silicone can cause lung diseases and emphysema. Cancer such as lung, liver, brain, and blood. So questions regarding their work and environment and their where they live as well. So young adults, our health concerns for young adults is one of the major things is stress. And this can come in many different forms. In this age group, stressors are normally related to family and job. Addition to the family, changing family structures can be stressful. Moving away from or back into family settings. Family is also defined differently in this age group. Family is often those who are closest to the patients emotionally and physically. A young person living far away from family may identify a roommate or a coworker as family. This age group views family structure differently. Job stressors from a new job, a change in job, or the challenge of actually getting a job all cause stress in this age group. Infertility is also a health concern for this age group. Can be due to many reasons: previous STIs, obesity, genetic disorders. The nurse wants to try and assess the patients who are trying to conceive and any possible potential barriers to conception. Obesity is a health concern of this young adults. Obesity is a national epidemic that can lead to heart disease, diabetes type 2, joint problems. The nurse should assess the patient's weight and risk factors related to obesity, such as lifestyle and diet. Another health concern is exercise. When are they going to exercise? Where are they going to exercise? Jobs and family changes often make it difficult to engage in physical activity. Money and location can also be barriers to getting exercise. The nurse should assess the patient's ability to actually take part in physical activities as well. So next we have our middle-aged adults. They make up about 40% of our population. Often they're referred to as the sandwich generation because they have children that they're taking care of and they have older parents that they're taking care of. So think about their health and safety risks. Are they really any different of the young adult? They really aren't any different than the young adult. So that list we just went over for the young adult also would be for the middle-aged adult. So family history, personal hygiene, violent death and injury, substance abuse, STIs, and environmental occupational factors all are important for our middle-aged adults as well. Additional safety concerns are health promotion and stress. Health promotion for this age group, I wouldn't say is more difficult, but part of that is related to stress of taking care of other family members, earning enough money for the house, potentially having grown children and having older parents they have to take care of, having young children that they have to take care of. So it's just different forms of stress. And the stress can often cause alterations in how well they take care of themselves or their health promotion. Additionally, obesity is still a concern here. And now we are going to talk about anxiety and depression in our 35 to 64 age group, or our middle-aged adults. This is when we see anxiety and depression rates increase or skyrocket during this time. If you think about Erikson's stages, wondering what stage of Erikson's development are they in and what stage should they be in is often what causes the anxiety and depression for our middle-aged adults. So now let's look at some passive and active health promotion behaviors. So with young and middle adults, we think about passive health promotion. These are things that other people have done for us, laws that are in place that are health promotion, such as fluoride in water sources to help with dental hygiene, seat belts to help with motor vehicle accidents. IPV is intimate partner violence laws. Hand washing signs everywhere to decrease the spread of infection. OSHA laws. When you go into the clinical settings, sometimes you have to wear like a special mask if you have someone that has TB. Or if you get exposed to a sharp for some reason or get cut with something, you have to have another tetanus shot. Those are all OSHA laws, so they're passive forms of health promotion. We have active forms of health promotion, to know their family history and to be aware of their family history and to take steps to prevent diseases such as heart disease. So if a patient knows that there's heart disease in their family, then following a low-fat diet and not smoking and engaging in activity is considered is considered an active form of health promotion. Hand washing, the signs can be everywhere, but until we actively take part in the hand washing, it's not active. Oral hygiene, brushing teeth at least twice a day, if not 3 times a day, and flossing. Seatbelt use, we have laws against it, but you have to actually do it to make it active. no impaired driving, no prescription abuse, minimal alcohol use, smoking cessation classes, condom usage, and no job or living near possible pollutants were all considered active forms of health promotion. Young adults. Some more active forms of health promotion for young adults that could be suggested are meditation, laughter to keep their BMI within normal limits, no sexually transmitted infections, diet changes, and daily activity. So the laughter and meditation, excuse me, not medication. The meditation and the laughter can help with stress reduction, BMI within normal limits, and no sexually transmitted infections, can help with infertility issues, and diet changes and daily activity can affect obesity. So then we move to our older adult, over 65, is about 13% of our population. And by 2030, it's estimated that 72.1 million Americans will be over the age of 65. We have the health risks and concerns of this population are heart disease. I would like to point out that heart disease is considered a health concern for everyone. Heart disease and heart disease and obesity in our culture, in our country, are considered health concerns for everyone due to the type of diet that is followed in this country. So be mindful of that everyone should be assessed for the potential of heart disease. Cancer. Patients that are over the age of 65 do have a higher risk of cancer, and part of the reason for that is that we all have cancer cells floating around in our body, but it's our immune system that attacks those cancer cells or sees those mutated genes as abnormal and kills them. As you get older, your immunity, your immune function, or your immune response slows. So those cancer cells are allowed to actually grow and mutate more. Strokes, they're also called CVAs, or cerebral vascular accidents, are at a higher risk for patients over 65. Smoking. Smoking at any age can still cause cancer. Alcohol use, and then nutrition here is often a problem with patients over the age of 65. That can be for several reasons, as you well remember from your nutrition lecture, or you will learn in your nutrition lecture. Alterations in taste due to just the aging of taste buds, as well as medications, or dentures that don't fit well, or poor dental hygiene can also alter the patient's ability to actually chew the food, which deals with their nutrition, or their changes in their GI tract will also alter their nutrition as well. So older adult health risks and concerns, we have dental problems, exercise, and chronic pain. So dental problems, like I said before, if you have ill-fitting dentures, that's going to lead to malnutrition and weight loss. Exercise, are they able to exercise? So nurse should always assess the patient's ability to exercise and what type of exercise should they be engaging in. Should it be cardio exercise, or maybe swimming, or seated weight exercises? What's best for that patient? And then the issue of chronic pain. Our older adults do live with chronic pain, general wear and tear on their bodies after years. They have to look at, are they taking medications, and how those medications affect their cognitive ability, how those medications affect their bowels, and how they affect their daily function. And then some safety risks for our patients. Depression. A lot of our older adults suffer from depression, and that can be a risk with suicide. Changes in memory. We've all, seen the silver alerts as we're driving, or seeing them on the big screen, or getting the silver alerts on our phones. We have older patients who wander away from home. They don't know who they are. They don't know where they are. And that they have massive changes in memory. That can be unsafe for patients who are not supervised. Falls. and I'm sure you've talked at length about falls in your 153 class. There's lots of things that cause falls. Polypharmacy is a safety risk that can cause falls. Polypharmacy can also lead to depression and changes in memory, as well as constipation and cognitive issues. And then sensory impairments. Sensory impairments will precipitate falls as well, but sensory impairments can also cause isolation, which will lead to feelings of loneliness and depression. Older adult health promotion. Some things our older clients can do to promote their health is have their regular screenings, their regular colonoscopies, regular bone density tests, regular exercise, weight reduction, low-fat diet, moderate alcohol use, dental care, still going to see their dentist every 6 months, smoking cessation, and will help with lung capacity, and then immunizations. The older patients and the younger patients are the ones who really need the flu vaccine. We need it as well because we're taking care of these populations, but older adults should be immunized as much as they can be, so that they're not carrying diseases to their friends and their family, and they're also not getting sick from these diseases. So they can be immunized against hepatitis, B and C. They can be immunized against, not C, excuse me, just B. And A, probably they wouldn't be A, more of a healthcare worker or a daycare worker gets A. Flu vaccines, pneumonia vaccines are very important for this generation, as well as the shingles vaccine. More health promotion is to remove any environmental hazards that may be related to falls, using assistive devices correctly, wearing glasses and hearing aids as prescribed, using the correct footwear, and avoiding polypharmacy. All of these things you do need to think about when you're going into the clinical setting, looking at assessing this and what can we do to help promote the health of our older adult. They can do these things, yes, but we can do them as well to help promote their health. So assessment activities. How do we assess what our patients need or what they should be suggested as far as health promotion activities are concerned? So physical, we have, we're going to look at height and weight, food diary, sensory assessment, can you hear, can you see, those types of things. Range of motion exercises, oral cavity exam, taking out our pen light and looking around in their mouth, looking for any sores or for any loose teeth or areas where we don't have teeth. Questions related to oral hygiene, so that you can use that time as a teachable moment. Talk about appropriate time to brush and floss. Interview related to family history, so you can get a better understanding of what their parents and grandparents died from, and what diseases run in their family will help assess what type of teaching they need. And then understanding their medication use and also their medication history, what they've taken in the past. Physiological things you want to ask is, has anyone hurt you? Lots of times on our admission documents we'll have questions. Have you been hit, slapped, punched, kicked within the past 6 months? Are you afraid to be at home? Are you afraid to be alone? Do you feel like hurting yourself? Do you feel like hurting anyone else? And those questions are standard parts of admission assessments. You're going to look at the affect and their overall appearance. Do they look like they've bathed? Do they look clean? Are their clothes clean? Are they buttoned correctly? Do they make eye contact when they speak to you? Understanding if there's a history of mental illness or substance abuse. Looking for any signs and symptoms of anxiety, which would be repetitive words, losing train of thought, not making eye contact, short, quick sentences. Any physical assessment related to unknown injury or bruising can be part of the psychological assessment as well. And then also the family statements about job or family-related stressors. Have your ears perked up and be on alert for, I've just changed my job, or my husband just lost his job, or we no longer have health care benefits, or now we have to take care of his mother. All of those things are hinting that there are stress within the family related to changes in family structure or financial reasons. Risk factors for illness. So we have acute and we have chronic as well. So acute would be things that would bring you to the hospital. We have hand washing. So we often get ill from other people and have acute illnesses. We get flu, pneumonia, respiratory viruses, GI distress, all from poor hand washing. Accidents will land you in an acute situation, broken legs, whiplash, things like that. Family history. So family history can land you in the acute care setting, but can also cause chronic problems. And a good example of this is heart disease. So if you have a family history of heart disease, you can be seen in an acute care setting or have an acute illness from having a heart attack. But now you have heart disease. So it's now a chronic condition where you have to take medication to control blood pressure, potentially to control lipids because of that family history. So you notice that they're on both sides. If we go over to chronic as well, you can see that there's smoking, which can cause lung cancer, alcohol and drug abuse, which can cause kidney and renal failure, and then poor diet, which a poor diet can lead to obesity, or it can also lead to anorexia. But just because someone is big does not mean they're healthy, and just because someone is small does not mean they're healthy. It all has to do with the diet or the nutrients that they're intaking. So that's the end of this presentation. This content will be tested on one of your exams. Please speak to your faculty member on which exam the content will be located. This is Miss Rebecca Sinclair Bennett. You may email me at rsinclair@ccbcmd.edu or through Blackboard if you have questions regarding the presentation. Thank you.